investigation of ultrasound in pediatric appendicitis, fancy toy or precious tool. And your tutor is Professor Laurea and the discussor, Professor Felix. Please.
Good afternoon. It is well known that the diagnosis of acute appendicitis in children was traditionally a clinical diagnosis that is based on the individual ability of the clinician to recognize the specific signs and symptoms of the pathology, sometimes with the help of laboratory tests. The problem is that, especially in the pediatric population, it is often quite difficult to collect a thorough history or to perform a physical examination in frightened children or in crying toddlers. And moreover, the clinical picture of the disease itself is frequently confusing and unreliable. Therefore, we can say that the diagnosis of acute appendicitis in the pediatric population is often challenging. It is necessary to transform this individual art into an evidence-based science, also thanks to the help of the diagnostic modalities available. And the recommended initial diagnostic modality to evaluate the children is ultrasound. It is a technique with high sensitivity and specificity for the disease, and also high positive likelihood ratio for this pathology, but without additional risk for radiation, pain, and sedation, which are important parameters to take into consideration in the pediatric population. Thanks to the use of ultrasound, we can therefore transform the challenging clinical diagnosis into a more immediate and visual one. In recent years, also thanks to the availability of more portable and intuitive machines, point-of-care ultrasound made its way into the medical scenario. Point-of-care ultrasound is defined as an ultrasound made directly at the bedside of the patient and performed by clinicians and not by radiologists. It is a goal-directed examination that is designed to answer to specific questions thanks to the recognition of easily learned and straightforward pattern, and the findings can then be integrated into the clinical picture of a patient's need by directing the clinical decision-making in a time-effective manner. In our institution, point-of-care ultrasound is not performed in the pediatric emergency department, and the aim of our study was to evaluate the impact that, in this case, radiology ultrasound performed during the initial emergency department assessment had on the subsequent outcome of the children. We particularly focus our attention on the potential that ultrasound has in speeding up the diagnostic process of the children with acute appendicitis, and also on the consequences that the faster diagnosis had on the subsequent management and outcomes of these children. We retrospectively evaluated 170 patients with acute appendicitis, and we divided them into two groups. The echo group, where the children in which ultrasound was performed during the initial emergency department assessment, while the control group children did not receive an ultrasound during the ED visit. We evaluated those children in terms of clinical presentation in the emergency department. We calculated the time that spanned between the start of the emergency department assessment and the entrance in the OR of these children. We calculated the duration of surgery, and we evaluated the course of the operations and the post-operative period. All of this to see if a relation with the timely ultrasound existed. The first and most important result that we found was that despite an homogeneous emergency department inflow of the patients, with 70% of them presenting during the daytime hours, there is a big difference in the emergency department OR delta T that was defined as the time that passed between the start of the emergency department visit and the entrance into the OR. We found that the echo group children waited on average 442 minutes, while the control group children waited 815 minutes. This means that the control group children almost had a double waiting time, waiting on average 7 hours more than the echo group children. Moreover, many of those children were operated also the day after they presented to the emergency department. The first problem that the first question that we asked ourselves, given also the retrospective nature of the study, was the reason why some patients were sent for an ultrasound while others were not. And we found an answer to this probably in the initial clinical presentation of the patient in the emergency department, because we found that children in the echo group were the ones with the most confusing clinical presentation, presented with